Welcome back. Welcome back to Open Your Eyes. We're now moving into our third segment for the morning. This one is actually about a telethon fundraising event, and it's going to be held under the theme Diabetes Care and Control. Save your kidneys, invest in your health. Now, in to tell us all about it, we've got Lynette Valerio, who is the acting president of the Belize Diabetes Association. Also, we've got Chantel Lofter of Belaifa as well, and they're both on the screen. Good morning and welcome to both of you.
Good morning. Thank you.
All right. It seems that the energy is just right for the morning. So let's talk about this telethon. I mean, we're looking forward to it every year. We hear about new things and innovative ways of how we could get things done for this event. So let's start with Miss Lynette. Miss Lynette, tell us about it. What's going on for this weekend?
Exercises do you do?
Great, John. Thank you for having us, and thank you, everyone, for tuning in. The Telethon 2021 will be held on Saturday, March 13 at the ITVET. The three organizations, Belize Diabetes Association, Kidney Association of Belize, Belaifa, decided last year that we needed to raise some funds because during 2020, when we had COVID-19, a lot of our patients suffered during the year.
Wow.
There were some cases where the condition worsened for some people. People living with diabetes, for example, saw that glucose levels increase, kidney conditions worsened, people's eyes deteriorated, people had lower limbs amputations, such as their toes, and in some cases, foot got amputated. And we were not able to do the usual fundraising that we would normally have during the year. Besides that, a lot of the resources in the health service centers were directed to COVID-19. And besides that, because of COVID-19 and all the fear, persons living with these non-communicable diseases were afraid to come out. And so stress levels went up. And sadly, we lost some members along the way.
Wow.
Yeah. Decided that, we need to do something. We cannot wait until COVID-19 is all gone and clear before we start helping our people. And the organization decided that we must do something. We need to get the public to help us in raising these funds. Yeah. And we understand that 2020 was a very challenging year. We have created also a GoFundMe account to reach families and friends in the diaspora, people in the United States, in Europe, in UK, in Canada, and all over the world. We want our families and friends and even people such as donors and sponsors to support us by using the GoFundMe account. And so that was the basis of the telethon. And so we feel that it's something that we need to do because we want to help our members living with diabetes. We want to help our families, loved ones, and even you who are living with diabetes and kidney disease. So this is why we're doing this fundraising. And Ms. can share a little bit more about kidney.
What's the aim? What's the target amount that you're aiming for?
The target, Marlene, is $100,000 Belize dollars. The period starts now, which is March 11th, World Kidney Day. Yesterday, we celebrated World Kidney Day, and we will conclude on World Diabetes Day, which is on November 14th this year. So we have that period, and that's the reason why we call it Telethon 2021, to be able to run throughout the entire, most of the year.
That's so helpful because I was wondering, clearly to raise that type of money in one day would be a lot, but you are leaving it open for a period of time. Lynette, one of the things that I think people don't know is what organizations like Kidney Association, Diabetes, and Belaifa, who helps to raise funds for you, what you do for patients. For example, at Diabetes Association, you guys have been offering strips, and testing equipment and medication for diabetics for a very long time. Tell us about what you use these funds for.
Great. So we have a lot of people living with diabetes. And this is a condition that really some people may have diabetes presently and don't even know it. So important that they do testing. And because of our lifestyle, the way we carry ourselves, what we eat, the lack of exercise that we don't incorporate into our lives. So we are at risk for diabetes. And unless we change some of those habits via awareness campaign, more promotion, more screening for people, until we do that, then people will become very cognizant that this is something that they really need to manage. Because maybe 5 years from now, persons who do not have diabetes will develop the condition. And the World Health Organization projects that in the next 10 to 20 years, we will see more people living with diabetes.
Yeah.
And that's sad. In Belize, we want to be able to, as much as possible, delay diabetes, delay complications from diabetes, complications such as blindness, kidney disease, and lower limbs amputation. So we appeal to international donors as well to provide us with the diabetes supplies. And then funding also comes so that we can have monies to buy insulin, buy syringes, buy strips, because these are
and then you offer it at a lower cost to people who go to the association, right?
Yes. And in some cases, if they cannot afford it, we just have to give it.
Yeah.
Because, for instance, insulin, persons living with type 1 diabetes, they need insulin every day. If they don't get the dose of insulin, they will die.
Yeah.
Wow.
Yeah. So let's bring it. Oh, is Anna with us as yet?
Anna is there. Anna?
Ms. Anna should be.
Hi, good morning.
Good
Hi,
morning,
good
Ms.
morning.
Anna, from the Kidney Association of Belize. And so Lynette gave us an overview. This is a collaboration between these organizations. And, you know, when you think of how diabetes is so prevalent and how diabetes can very easily lead to chronic kidney conditions and the need for dialysis, it's such a, it's a partnership that makes so much sense. So let's talk about the situation that you guys have there with the Kidney Association in needing funds to help your clients.
Well, you know that every year we do fundraising activities to be able to assist our patients. We have so many patients that need our assistance. Every day I'm receiving calls from people asking for us to assist them, and you know, we cannot close doors on anyone, so we try to assist them as much as we could. Since the pandemic started last year, we were not able to continue with our fundraising activities. Hence the reason, as Ms. Valeria was mentioning, we decided to join in this partnership and go towards this big fundraising as the telethon. That way we will be able to raise more funds together, and you know, diabetes and kidney have always been working together. And I think it just shows people that we are there for them, and diabetes care and kidney care for our patients.
And
you know,
your kidney
treatment
patients,
is very expensive. Sorry?
I was just about to ask you that, because your kidney patients, those who need either emergency dialysis or long-term dialysis, it is an unbelievable expense and burden for many.
Yes.
Talk to us about what the average cost is and how you help people, especially given the cost of dialysis care.
Okay, the cost, remember that a patient that is being diagnosed with renal failure, the treatment is, they are to receive is 3 dialysis per week. And remember, some of these patients, by the time they start dialysis, they are not able to work. And so they depend on their families and fundraising activities that their families do. And so they call us to assist. What the Kidney Association do is they try to assist them with dialysis. We cannot pay all the dialysis for each and every patient because we don't have enough funds, but we try to assist as much people as possible.
Yeah.
I could imagine. And I'd like to get Chantel Lofter in. Chantel, good morning once again, representing Belaifa. Give us your aspect. Tell us about what you guys are doing to get this ball rolling.
Okay. We will promote. We are trying our best to promote awareness on the importance of taking care of oneself, no? Mentally, physically, and emotionally. We have adopted Belize Kidney Association, and we were happy to join in collaboration with Diabetes Association as well, no? We look forward to helping them. Every year, we would do a big fundraiser, which is commonly known as the Red Gala Dinner and Dance. But due to the COVID situation, we are unable to do that for this year now.
Yeah.
We look forward to helping them raise that $100,000 and also do our part when it comes to promoting awareness, promoting good healthy living, eating lifestyle, changing our habits and ways of eating, no? Changing our mindset.
Yeah.
It's always better to take away the if I had and replacing it with yes, I am secured, right? And although for last year we were unable to do all these health fairs, join Kidney with their health walks, we look forward to doing that for.
And
for
you
this
usually
year,
have your
2021.
you usually have your Red Gala, which is a big
I love it. That's a great
fundraising event,
yes.
which
That's right.
could not happen under COVID times due to all the restrictions and just the things that we're not doing. So I can imagine how this now becomes an opportunity to try to get that money going from the people who usually support you.
That's right. It's really it's a first-hand experience when we see our clients and other people out there suffering, having to have to do fundraising and ask for money to meet these expenses, especially for kidney failure. Is really costly.
Yeah.
Right. So we're always happy to help.
And I've got to say this, that kidney failure and all these things that we're talking about, they don't single one person. And so for this reason, they ask for everybody to contribute as much as possible. But let's talk about what should be expected for tomorrow. What time does this telethon start? Who's expected to be there? What can someone do to help tomorrow? Starting tomorrow, actually.
Okay. The telethon starts at 9 o'clock. We have a fully packed day. We will have phone operators out there. I believe the flyer will be showing. Someone can call in and donate. Call in and donate. Tell your friends, tell your family, the co-workers, the businesses. Help. Every little penny counts, and it's for a better cause. The Senate can do more in depth with regards to the planning.
Ms. Lynette?
Yes, John. So the day will be packed indeed. We start at 9 a.m. and it will go until 4. And throughout the day, we will have some testimonials from persons living with kidney disease and persons with diabetes. So these persons will be sharing their own story, their journey with these conditions. So we have small little videos on these testimonials.
Yeah.
We also have small videos from some doctors who have worked closely with our organizations. Doctors who will have a small little presentation, talk about the medical condition that we have. We also will be having some entertainers as well who will support us throughout the day. And of course, we want the phones to keep on ringing. We have telephone numbers that I can share right now if you allow me to.
Sure.
Yes.
Okay, so we have 0800 280 CARE, and that's smart. 0800 280 2273. And for Digi, we have 0800 543 6397. Those are the numbers to call, and we will be there. Like I said, it will be a packed day with testimonials and videos and entertainments. But most importantly, we want people to know that every dollar will make a difference. Ms. Anna mentioned $200 pays for one dialysis.
Yeah.
A person needs about 3. $50 donation will pay for one A1C test for a person living with diabetes. $2 will pay for 1 year of A1C test. And all persons living with diabetes need to have an A1C test.
Yeah.
They need to know what their A1C test that is. And that cost is $50.
Yeah.
And just a $50 pledge can pay for one, and we need for 3 months. So we want the general public to know that every penny or every dollar will be an investment that they'll be making to our cause and to persons living with diabetes and kidney disease.
What about bank transfers? We know how things are working now. Banks are making it easy for people to transfer money from one to the next. What banks will you be working along with to make this happen?
We're working along with Atlantic Bank, and I will be sharing the account numbers. Atlantic Bank is under Kidney Association of Belize. Atlantic Bank, account number 10-03-21-028. And that is anyone wants to make a donation straight to the bank. We also have Belize Diabetes Association, Belize Bank, account number 133-7440-1012-0003. And we also have, sorry, that's Belize Diabetes Association, yes. And we also have the Belize Association of Financial Advisors. They're using Scotiabank. And we have the account number 9143621. Every dollar counts, so let's make donations. Let's call tomorrow for your donations. And we will also be airing this all day on Love FM, e-radio, and Facebook page.
Channel 5 as well. And
Channel 5.
we want the public to also view our Facebook pages, and we will take pledges from our Facebook pages on the telephone. They can also call our offices to get those bank accounts again, and share the GoFundMe account with your friends and families in the world, in the diaspora, in all over the world, because we want to be able to raise this fund. And like I said, pledges can come in, and we have the period from March 11, 2021 to November 14, 2021 to raise this target of $100,000 Belize dollars.
Yeah, definitely. And I do think, you know, the GoFundMe is going to be a great addition that people, even if they don't have it tomorrow, they can be able to donate when they can, or people who are living abroad who want to assist us as well. We do wish you the best of luck. Over the years, we've talked to so many different persons who have struggled with either chronic kidney conditions or diabetes,
kidney failure. So there've been a lot of stuff. And finally for me, guys, every day there are new people being diagnosed with diabetes or kidney failure, renal failure. Let's quickly go over the check of the body in terms of how do you detect, how do you know at what point, you know what, I really need to go and check now. Miss Anna, share that with us, or Miss Lynn, can you share that with us, guys?
In reference to kidney, remember that at the beginning, there are no signs nor symptoms. That's why we recommend that a person do a yearly checkup test. That's the only way you will find out if there is something wrong with your kidneys, unless you are already going to stage 4 and 5. But for that, you won't have any signs or symptoms. So we do strongly recommend that you do a kidney function test every year. Cannot be waiting until you are on stage 4 and 5 of kidney.
Okay.
So we do recommend that you do have this test. Ms. Valeria?
Yes. So with diabetes, some of the symptoms, and they vary from person to person, but most of the frequent symptoms are frequent thirst and urination. Persons who are overweight and obese are really at risk for diabetes, because as you know, John, diabetes is too much glucose in the blood. And we get glucose by the carbohydrates we eat. Too much carbohydrates, it's not really good for the body, because the excess carbohydrates are broken down and converted to sugar. So when we eat a lot of rice and beans, a lot of tortillas, a lot of pasta, and all these starchy food, the excess gets broken down into glucose. And that glucose stays in our blood. And that's why we have what we call sweet blood. And when there's too much glucose, it can become toxic. And remember, we have this blood, and every part of your body has blood cells. So when those toxic glucose affect our blood vessels behind our eyes, we start to have blurry vision. With too much glucose, it becomes toxic, and the kidneys have to work harder to flush out those excess glucose out of our body. And that's what would end up with kidney diseases. And because there's too much glucose, the blood is not flowing so well. And so the extremities, parts of our body, does not get the blood that it needs. And that's why we have people having lower limbs amputation, because there's not blood flowing all the way to the toes and to the feet. And so some people will develop neuropathy, numbness in the feet, and they are not able to feel anything. So when their feet get pricked or injured or cut or wounded, they wouldn't know. Some people are walking on fractured toes and fractured feet and would not
They
even
have no idea, yeah.
And that's why we recommend taking your medication for persons who have diabetes. And if you do not have diabetes, exercise. If you are overweight, reduce that weight. If you're living with diabetes, your A1C is your gold standard test.
Yeah.
And that number for A1C has to be 7% or less.
Yeah.
And so we recommend people to do your exercise and manage your diabetes in order to delay any further complications, because diabetes will affect the entire body.
Yeah.
Wow.
All right.
Well, you guys have told us indeed. So tomorrow again, 9 o'clock at the IT Vet compound. And yes, people of course you could watch it on 5 as well, because we'll be carrying that throughout the day. And you could make your pledges, so we could find that information once again on your Facebook page.
Yes.
Yes.
All right.
All right. So guys, thank you so very much, and do enjoy your day. We know that the preparations will go into high swing now. So all the very best to you, and do enjoy your Friday. All right.
Thank you, Jen and Marlene.
All right.
Thanks,
So
everybody.
we are about to take our final break. When we come back, we will be wrapping things up. Stay with us. We'll be back.